Could we all please stand for the Pledge of Allegiance? Ready? Begin. Thank you so much. If we could now have the roll call.
Yes. Chair Williams,
Present.
Vice Chair Walshaw. Here. Commissioner Whip. Can you unmute? Commissioner Whip, are you with us? Commissioner Whip, if you can hear me, please unmute your phone. Commissioner Howell? Present. Commissioner Costa?
Present.
Commissioner Keller?
Present.
Commissioner Schott? Sherry Schott? Commissioner Webster? Commissioner Whip? Okay.
Thank you. Do we have a quorum?
5, 6. Yes, we do.
Thank you, Madam Secretary. Okay, so now we're going to I'm calling for the approval of the minutes of September 22nd, 2020. Everyone had an opportunity to review over the minutes at this time, so I will entertain a motion to approve those minutes. Do we have a motion on the floor?
Move to approve.
Okay, so it has been properly motioned by Vice Chair Walshaw. Do we have a second?
I'll second.
Okay, it has been properly motioned and second by Commissioner Howell. All in favor, please indicate by saying aye. Aye. Any objections? Any abstentions? Motion carried. I want to remind everyone to please mute your phones at home because we are doing the meeting via Zoom as well, and unmute yourselves when we call on your name. Or mute your television so that there's not a lot of background noise while we're conducting tonight's meeting. Next on the agenda, we have City Council Liaison, Councilmember Esther Sanchez. Is she present tonight for a report? Okay, she's not present.
No, she's not.
Okay, thank you. So we have audience communications. Do we have anyone to call in tonight with any communications from the audience?
We've had no requests to speak.
No public communications?
No.
Okay, thank you so much. And so now we're going to go to agenda item number 5, which is items for discussion. And tonight we are going to be appointing a chair for the ad hoc committee to address homelessness. Do we have anyone here on the commission that is interested in being the chairperson for the ad hoc committee on homelessness? Okay. So I am going to recommend that position for Commissioner Cornett. He's not here tonight. He wasn't able to be here. He does have an excused absence. And so I will make a recommendation for him to be the chair for the homeless ad hoc committee. And at our next meeting, he can consent to that or decline that recommendation. So at this time, I'm going to call for the committee to go up on my recommendation, and all in favor of my appointment of Larry Cornett to be the chair for the ad hoc committee with his approval, please indicate by saying aye.
Aye.
Any objections? Any abstentions? Motion carried. And so we'll, at the next meeting that we have, we'll give him an opportunity to accept or decline. But as it stands right now, he is the chairperson for the ad hoc committee unless he declines. Okay? And so next, we're going to go down to our next item, which is the approval of the 2019-2020 Consolidated Annual Performance and Evaluation Report for the city's use of housing and urban development, the HUD program budget for Community Development Block Grant, CDBG, and Home Investment Partnership Funds, home funds. And we're going to have Ms. Cecilia, the management analyst. Oh, she's already up there. Okay, come on with your report, Cecilia. Thank you.
Good evening, Chair Williams and Commissioners. Thank you for being present this evening. So every year, staff takes in front of you the end-of-year report for the prior HUD funding year. It's called the Consolidated Annual and Performance and Evaluation Report, and it talks about how we used our CDBG and home funds for the past cycle. The attached report kind of identifies the different housing and community development objectives and what we actually performed in those years, both with our HUD monies and our non-HUD monies in terms of the actual programs and activities. So staff is asking that you recommend approving this consolidated plan so that we can submit it to HUD as required by December 15th. Normally, it would be submitted in September, but due to the pandemic and things of that nature, we did request and were granted an extension by HUD, and that is the final filing date for this report. I am available for any questions on the staff report or the attached projects, objectives, and activities and outcomes that was presented to you. Thank you.
Does anyone have any questions about the report? We all received the report via email as well as the mail. So we all should have had an opportunity to review the report. Do we have any questions at this time? Okay, Commissioner Costa.
I'd like to find out if the monies that couldn't be spent because of COVID, whether they'll be rolled over to this coming year, and would you get a decrease, or would you have the same incoming budget from the government?
Okay, the funds for the prior fiscal year were completely spent out. All the activities, even during the pandemic, did continue. Their operations changed somewhat due to the pandemic. A lot of the public services continued to do their programming, but it was via virtual or other methods, not in-person type of programming. Public services are not allowed to roll over. They are only in that fiscal year, so any funds not used by the end of the fiscal year roll into our CDBG kind of fund balance for non-public service activities. For this upcoming fiscal year that we are currently in, the agencies are submitting proposals that are addressing the pandemic as part of their activities and in terms of how they're operating. Similar to what was done in the prior cycle in terms of virtual call-in, checks-in, that type of thing, or limited activities in-house due to the pandemic and social distancing guidelines.
Are you finding a decrease in the effectiveness of the programs because of it?
We were definitely impacted by the pandemic because of the number of people served has been decreased because of sizing and other restrictions. So yes, all the programs across the board were impacted.
Is there anything that can be done that would address the problem and maybe have a program that would take into consideration the problems that you're encountering?
As part of my next presentation, when I go into our CDBG CV funding, I can talk a little bit about what one of the actions that we're proposing.
All right, thank you.
Thank you. Do we have any other questions?
I have a question.
Okay, Vice Chair Walshaw.
Hello. On the activities part, under number 2, mobile home rehab and improvement grants, it's $6,000 per grant, and it says that one homeowner was assisted with grant assistance, and then 2 additional households were completed. One was funded in the next fiscal year, and the other home was unrepairable. And
Correct.
then it says that there's still, the waiting list is still 113 households. So the fact that there's $98,797 funding, is it going slow getting them turned over because of COVID? Is that what the delays are?
It is one of the reasons. Last year we had a few challenges. One is that we were working with our risk management, the attorney's office, addressing the insurance requirements. The city on the prior year upped their insurance from a 3-1 to a 2 and 4. And a lot of the contractors, that was too high for them, and we lost the majority of our contractors. We had a few that continued to work with us. So that was one of the challenges. The risk management did agree after kind of negotiations to look at rehab as that we act as the bank. The homeowner has insurance, so they approved us to go down to the former insurance requirements. So we anticipate that we're getting contractors back into the program. Secondly, the other challenge was also partly the pandemic and then staffing. We anticipate bringing a new staff person on board hopefully by the beginning of next month, and their main focus will be the rehab programs to push out rehab activities. That will be their main job.
Okay.
So we anticipate having higher numbers for reporting for next year.
Okay. All right, thank you.
You're welcome.
Do we have any other questions at this time? Question, what is the deadline for the agencies to request funding? I believe I heard you said that they could request funding.
For the public services, we have been in a kind of a rollover process since 2012, when all the HUD funding was basically decreased and it hasn't really gone back up. The city council at that point in time decided to fund programs and activities that are operating out of our resource centers or our recreation facilities. So the projects that we assist have been basically more or less the same projects in those areas, and they also serve the people most in need, which was identified at that point as youth and seniors. So that's been the main focus. So generally every year, the applicants resubmit an application as to how they're going to do for the next year, usually that June, because the new cycle starts in July.
Okay. So therefore, you have agencies who are assisting Oceanside's homeless because we don't have our own shelters or anything like that, and those agencies are not able to get any of this funding because we're only giving funding to the resource centers in
For our public service
Oceanside.
dollars, that is correct, but the city did several years ago provide significant funds to Operation Hope to help build that shelter because they do house some of the homeless populations for Oceanside. And I can talk a little bit more about what we're doing homeless related as part of our CDBG CV funding in the
Okay.
next
Okay,
item.
we'll get you back up. Do we have any other questions? Okay,
Yeah.
Commissioner Costa.
Could you elaborate a little bit about Section 8, what the restrictions are? Not what the entitlements are for a person to be in it so much, but what would keep a person out of Section 8?
You.
Commissioner Costa, let me talk a little bit about that. There are some restrictions for coming on to Section 8. Some of them are related to persons who have been involved with different types of criminal activity over a certain period of time. However, most of the ones we see are folks that have used drugs, and if they can show that they are in a program or trying to work towards sobriety and aren't currently using, we can waive that requirement. In terms of other types of items, folks that have been terminated from the program in the last 5 years, that would be another disqualifying factor. I'm assuming this is what you're talking about. Of course, there is an income limit. In addition, persons with disabilities, families of 2 or more, and seniors 62 and over are assisted prior to single persons. So we don't generally assist single persons with our regular vouchers who are not elderly or disabled because the need is too great for those other populations.
And what would I notice in a lot of the programs here that you have the income as being below a certain level. Now, what would that level be that they need to be below per year?
For Section 8, it's 50% of county median income by household size.
What is that?
So let me ballpark it. I think it's about 40,000, and this is just a file I saw recently. Maybe it's 45,000 for a family of 2. However, we are required to dedicate 75% of all new vouchers, or anytime we have a turnover voucher, people coming on the program, to people that are under 30% of the median income. So that's who we're striving to help for the most part, is what's known as extremely low.
Okay. Thank you. I couldn't find those figures anyplace, that's why I asked.
If I can add, for the HUD funding, we're at 80% or below of median income, and perhaps we can send out our income chart that identifies the income standards out to the Housing Commission later, so that you have it at your fingertips.
Okay, thank you.
Do we have any other questions?
Yeah, I have a question.
Commissioner Howell?
Regarding the summary of resources for 2019 and 20, the $24 million that was spent, you said, right, on all the programs, are you asking for the same amount of money? Are you asking for more money, or?
The total funding allocation is just showing kind of in general for housing and community development what we have in our house.
Okay.
Some of it is not new money, it may be reuse money. For example, the Cal Home money is just basically what's remaining in that account. The housing set aside is kind of what we have because of the dissolution of redevelopment, so it's not like some of these are not new. But my specific piece is really the home and the CDBG.
Thank you. Do we have any questions from the phone or from the Zoom meeting? Okay, thank you. No other questions at this time? So this is an action item for tonight's agenda. So I will entertain a motion to approve the 2019-2020 Consolidated Annual Performance and Evaluation Report, which is for the city's use of housing and urban development program budget for the Community Development Block Grant and Home Investment Partnership Funds. There's a motion on the floor. Do we have anyone? Okay, Commissioner Costa, do we have a second? I'll second. Okay, it's been properly motioned by Commissioner Costa and second by Vice Chair Walshaw. All in favor, please indicate by saying aye.
Aye.
Any objections? Any abstentions? Let the record reflect that the motion has carried. Thank you so much.
Thank you.
Okay, so we're going to go down to our next item for discussion, which is Veterans Administration Report. So we're going to have a report coming from the VA at this time. Okay. Jessica Chamberlain, thank you.
Hi, good evening. Can you hear me okay?
We're going to give you some volume.
Okay.
Thank you for being patient. Okay, we're ready for your report now.
The
Thank you, Jessica.
presentation is up.
Okay, let's see. All right, well, good evening, and thank you for inviting me to present tonight. I'm Jessica Chamberlain. I'm the Chief of Social Work at the VA San Diego Healthcare System, and I'm also currently the acting Homeless Program Coordinator. So I'm providing coverage while we work to get that position filled. And so that's why I'm presenting this evening. And I'm going to share with you an overview of the national and local state of veteran homelessness, and then speak to our permanent supported housing program, HUD-VASH. Okay, you can go to the next slide. I can't see the slide, so I'm hoping that we're... Okay, great. The Department of Veterans Affairs remains committed to the goal of preventing and ending homelessness. The VA's goal is to make sure that every veteran has permanent, sustainable housing with access to high-quality health care and other supportive services, and that veteran homelessness in the future is prevented whenever possible or is otherwise rare, brief, and non-recurring. And we can go to the next slide.
Thank you.
This is a summary of the federal response to homelessness, and I think the important takeaways from here are, one, the federal response utilizes a housing first approach, which prioritizes housing, then assists individuals with access to healthcare and other supports that promote housing stability and improved quality of life. Second, the federal response prioritizes the most vulnerable veterans, especially those experiencing chronic and long-term homelessness. And then third, communities are working toward coordinated outreach efforts to identify by name and engage every veteran experiencing homelessness. And then last, there's federal support for all VAs to participate in their community's coordinated entry system to ensure that there is no wrong door for any veteran who is seeking help. So in San Diego, our homeless program utilizes the Housing First model. We've made a commitment to the community to target the chronically homeless, and we are working closely with the Regional Task Force on the Homeless on our homeless veteran by name list. And the VA also enters and shares data through the region's coordinated entry system. And we can go to the next slide. So nationally, the number of veterans experiencing homelessness in the U.S. has declined by nearly 50% since 2010, and over 800,000 veterans and their family members have been permanently housed or prevented from becoming homeless. And we can move to the next slide. So this slide is showing the reduction in homeless veterans compared to the reduction of all homeless people since 2010. So there's been a 49.9% decrease in veteran homelessness. Okay, you can move on to the next slide. This is a snapshot of veteran homelessness at the state level. So between 2010 and 2019, there was a 37.6% decrease in veteran homelessness in California. And you can move on to the next slide. This slide is looking at our region's point-in-time count data and looks at total homeless individuals in San Diego County and then total homeless veterans. The red line is all homeless individuals and the blue is homeless veterans. Since 2011, we've seen a 43% decrease in homeless veterans in the San Diego region. And then slide 8, you can move to the next slide. This slide here breaks down some of the 2020 point-in-time count data a little bit further. So from 2019 to 2020 point-in-time count, we saw an overall 12% decrease in veteran homelessness, a 25% decrease in unsheltered veterans, and a 3% decrease in sheltered veterans. So the next two slides, I'm not going to, you can go ahead and advance. I'm not going to spend a lot of time here. These two slides give an overview of some of the VA's national programs that serve homeless or at risk for homeless populations. I think there's a fact sheet that was included in your agenda or as part of your material tonight. And the fact sheet gives a much better overview and summary of the programs that are part of VA San Diego's homeless programs and services. So we can move, yes, to this slide here. So moving on to our permanent supported housing program, HUD-VASH. It is a collaboration with HUD to provide housing choice vouchers to participating public housing authorities. And the VA provides clinical case management services to assist veterans to obtain and maintain permanent housing and to fully reintegrate back into their communities. HUD-VASH operates on the Housing First principles and is intended to target and care for the chronic and most vulnerable veterans. And to be eligible for HUD-VASH, veterans need to be eligible for VA health care and must have a demonstrated need for case management services. In San Diego, to date, we have approximately 1,600 veterans that are permanently housed in HUD-VASH. And I think the next slide is the last slide, just some resources, and I'm happy to answer questions.
Thank you so much for your support, and thank you so much for coming out this evening and giving this report to the City of Oceanside Housing Commission. So at this time, we will entertain questions from the commissioners. Do we have any questions from any of the housing commissioners? Okay, so I have a question for you, Jessica. When we encounter a veteran who is homeless, who at the VA should we be referring these homeless veterans to? Do we have case managers here in Oceanside? Because we're here in Oceanside.
Yes, we have an outreach clinic at the Oceanside, the VA Oceanside Outreach Clinic. They can be referred over there. They can be referred directly to our homeless program. We have also a homeless hotline that veterans can call. I can get those resources together and send them to the chair or through Angie, however you would like to have them received.
If you can send them to Angie, please, and Angie can send them out to the commissioners, because we do have a large veteran population here in Oceanside, and that's one of the things that we're constantly faced with is how do we get them the help, and who should we be sending them to, and who is the point of contact? And do we have any other questions from any Commissioner Howell?
Thank you for that presentation.
Commissioner Howell, can you get closer to your mic?
There it is. All right.
Thank you.
Could you explain the reason that a veteran would be denied for services, the criteria that would be denied?
So a veteran, to be eligible for HUD-VASH, needs to be eligible for VA health care. And just very broadly, to be eligible for VA health care, you have to have a certain length of time in service and a certain type of discharge. So those things together could make a veteran eligible for health care and then subsequently eligible for HUD-VASH. Again, our program does target the most chronic and vulnerable. So we tend to target those who are unsheltered and street sleeping. That's our priority. We also do prioritize women and families and elderly. But somebody who may not be eligible for HUD-VASH, even if they are eligible for VA health care, could be somebody with a certain type of legal history, a felony, sex offenses. Those types of things could disqualify people from being eligible for HUD-VASH.
So I have another question. When you say eligible for VA health care, and I could be wrong because it's been a couple years since I was in the military, but aren't all of the veterans when they get out qualified for health care for the first 5 years of getting out of the military, or did that change? There is that caveat, and there are a lot of different caveats around eligibility for health care, especially with our newly returning veterans. So that's why I kind of said it in general, it does tend to have to do with discharge and length of service, but then there are the new veterans who have more expanded benefits for when they discharge from the military. And I just cannot speak to all the nuances of those. Okay, thank you so much. Do we have any other questions for Jessica?
I have a question.
Okay, Vice Chair Walshaw.
Could I real quick, just to follow up, I can also give information to Angie for our healthcare, our enrollment and benefits. So if veterans are wanting to get enrolled and may have questions about their eligibility, I can send that information to Angie as well.
Thank you so much. Commissioner Vice Chair Walshaw.
Okay. Hi, my question is, I've tried to assist a disabled veteran and his wife about a year or so ago to get into housing. They were being wrongfully evicted from their home in a mobile home park. And basically what happens is they attempt to pay the rent, the park owner refuses to accept rent from them, and then proceeds to try to evict them for the non-payment of rent. If they can't afford an attorney and they get served with an unlawful detainer, they've got 5 days to respond, and that usually puts them in a very vulnerable situation, which is what happened to these people. And what happened locally is that we were referred to the VA contact, and they went every day for, I believe it was 2 or 3 weeks, to try to see the person they were supposed to speak to, only to find out that because they were being reported as being evicted, which they had not been yet, but they were in the process of it, that they did not qualify for the program. And I'm wondering if there's some way to avoid stepping into that hole, or if there's something that we can do, because the last time we did a head count in the parks, there were over 750 veterans, and this is happening quite often now. So I'm just trying to figure out how can I better serve these people and avoid getting them in that situation.
Yeah, so if a veteran is enrolled in HUD-VASH, our case managers will work very closely with them and their landlord and the housing authority to do everything that we can to prevent an eviction from happening. But if a veteran is not enrolled in HUD-VASH and is being evicted, the VA does not provide legal resources. We unfortunately would have to refer a veteran if they needed legal help to legal resources in the community. So we're a little tied in how we could help somebody through an eviction if they aren't part of a program that we administer. We could provide other supports and resources in terms of other housing options or shelter programs, but legally we don't have resources to work with their evictions. They would have to use legal aid or other community-based programs.
Yeah, we stopped sending people to legal aid. It's treated as a landlord-tenant issue, and it's different. It's a different form of law and cost. But thank you.
Thank you. Do we have any other questions?
Yeah, it's not really a question. It's just to piggyback on a couple meetings ago, we had the HOT team here and they did a presentation on the fact that when they do find a qualified candidate that is a veteran that needs a VASH voucher, they're coming to your offices and they're being denied. And so I'm thinking maybe one of the reasons they're being denied maybe is because they're criminal history or they're a sex offender. But I know with housing, you can't really deny people for that. So I'm wondering why you guys still even have that as a criteria.
So for HUD-VASH, they have to meet the definition of homelessness, and many people are marginally housed but do not meet the definition for homelessness. They also must have to have a demonstrated need for case management. So without case management, they would not be able to obtain and maintain their own housing. So there are a lot of people who are very low income, but really it's their income that is creating their homelessness, not their ability to obtain their own housing. So these are folks who typically have mental health issues, have substance abuse issues, and without the support of case management cannot get and obtain their own housing. So there is a large population of folks that are very low income, very marginally living from week to week. They might house themselves for 3 weeks in a hotel and then couch surf for another week until their check comes, or live in a shelter for a week until their check comes. But the program is really meant for folks who, without support, aren't going to be able to obtain and maintain their own housing. So some people don't qualify.
Okay, thank you.
Thank you. I want to comment on that, but I want to do a little bit more research, because it sounds like if a person has PTSD and they're experiencing housing, they can get a house over someone who is actually getting out the military and just having a hard time in life and can't pay their bills because they're living paycheck to paycheck. So given between the two, case management, you're going to give the house to the person who may be suffering from PTSD, that need the additional services, over the person that's couch surfing. Did I understand that correctly?
It really is. It is a case management program that has the housing component attached through it, through HUD and the Section 8 voucher. And again, our priority is chronically homeless. And so again, our chronically homeless folks do tend to be unsheltered and street sleeping, and are typically quite vulnerable. So the person really does have to demonstrate the need for case management in order to obtain housing. And they could have PTSD and have a need for case management. They could, be elderly and medically fragile and have a need for case management. You could also have somebody with PTSD with no demonstrated need for case management, but is down on their luck and having a hard time finding a job. And that is somebody who likely would not qualify for the program. It's unfortunate we do have people who are very low income and living very marginally who won't qualify for HUD-VASH. So, it is a population that we that the HUD-VASH program can't support, but a population that needs support nonetheless. And I mean, the VA does have other programs. We have transitional housing programs that people can go into. We have partner with supportive services for veterans and families that folks can receive some short-term rental assistance and some rapid rehousing resources. So while not everybody might have the demonstrated need for case management to obtain housing, there are other programs that we would refer folks to if they maybe needed some short-term assistance, but it wouldn't necessarily be through HUD-VASH and a Section 8 voucher.
Okay, well,
So what's that criteria? I'm sorry.
Commissioner Howell.
I'm sorry. So what's that criteria? Because I just learned something moments ago, and that's good to hear because I was feeling a little down this moment. I'm like, what is this program for?
Yeah, I was
The odds are
very
not in our
focused
favor.
on.
Well, that's why we want to have the VA on, because we
Yeah.
didn't understand how is it that we have homeless veterans in Oceanside and we have vouchers, but we can't get the vouchers to our homeless veterans. And so we want to have someone from the VA to come on and explain to the commission what's going on. If they're homeless,
Why can't they get
give them a
housed?
place to stay.
Right.
We have the vouchers.
Right.
And
So
so-
the other program, so is the criteria the same?
So we have 305 transitional housing beds in the community. Some are in North County, some are in San Diego, and the programs vary on their requirements. Some of them are focused on treatment and substance abuse. Some of them are very low demand, low barrier programs that don't necessarily require a treatment focus or sobriety. So those are open to the majority of veterans who are wanting to engage in transitional housing. And, it is a program, it is congregate living, and there are, rules and whatnot. And sometimes veterans decide that that's not for them or something that they aren't ready for. But we have programs through Interfaith Community Services, through Veterans Village of San Diego, and through VOA. So we can refer veterans to those programs if they don't meet the criteria for HUD-VASH. And then supportive services for veterans and families. The VA funds it, but the VA doesn't operate it. Our community providers operate those programs, and off the top of my head, I can't name them all, but we do have programs, I believe, through PATH and Veterans Community Services. And, again, those are typically for folks who need some short-term help in housing. So it typically provides some rental subsidies for folks, usually under 6 months. And we could refer out to those programs as well. So if anybody is referred to the VA for services, for homeless services, we do try to match them with the most appropriate level of housing and services for their situation. So HUD-VASH isn't the answer for everybody, but there are other programs and options, and they really should be referred to the VA, to an outreach worker, so that they can do a full assessment and determine the individual's circumstances and what would be a good programmatic match or housing match.
Very good, thank you.
Thank you. Do we have any other questions at this time? Well, Ms. Jessica, I really appreciate you coming out and giving this report to the Housing Commission here at the City of Oceanside. Thank you so much. I think you answered a lot of questions and cleared up a lot of things for us, and hopefully for our community. This is being televised on KOCT.org, so you may get some phone calls to your office or
And
some
I think our,
emails from some individuals. But this is good, and I really do appreciate you coming out and giving us this report. So thank you so much.
Great, thank you. And I'll follow up with the resources with Angie.
Thank you. Thank you so much.
Thank you. Thank you for having me.
Pause for station identification. Is she logging off or is she staying on? No, she could stay in the meeting. We're not going to talk about her.
Chair Williams, are you interested in me giving an update as to where our VASH are?
Yes, it's right here on my agenda.
Good,
Thank you
okay,
so
sorry, I
much,
jumped ahead of
Angie,
you.
because we can
Pardon me.
hear from Oceanside staff to give an update about what's going on with our VASH vouchers here with the city of Oceanside. Thank you.
Thank you, Chair Williams. Sorry to jump ahead of you.
That's okay.
We have actually made quite a bit of progress in recent months with our VASH vouchers. So the VA has a partnership with Interfaith, and they're working very closely with one of their VA representatives. So I think that's made a big difference. Jessica didn't really mention that. But a status, we have 100 VASH vouchers. So you saw there's 1,600 countywide. So we're sort of the small fry out of the county of San Diego has a lot of them, and the city of San Diego has a lot of VASH vouchers. We have 54 veterans that are leased up right now with VASH vouchers, and another 13 are in the pipeline. Actually, there's more than that. This was as of October 1st. So as of October 1st, we had, November 1st, we had 13 in the pipeline. So we'd received quite a few referrals. We've received another 3 referrals this month as well. So it actually is moving along quite well in terms of getting referrals and getting veterans leased up recently.
Thank you so much, and thank you for your diligence in working on this to get our veterans taken care of here in the city of Oceanside. We really do appreciate that from city staff, making sure that we get these guys some housing. Okay, so we're going to go down next to our agenda item number 6B. We're going to have Ms. Cecilia come back and give a report on the CDBG CARES coronavirus funding.
Good evening again. Thank you. So I'm here to report on the CDBG CARES coronavirus funding that we have received from HUD in the past year. Move this here. And before I do that, I'd like to give you a little bit of the timeline for last year with the money that we received and how we addressed it. As everybody knows, the pandemic pretty much hit big time in March, and we were awarded an allocation of $788,485. HUD has been very proactive in regards to addressing potential impacts with this pandemic, and they provided agencies various waivers that you could apply for to address the unusual circumstances we were in. Some of the ones that we applied for was amending our citizen participation plan to allow for virtual hearings, also shortening the normal 30-day comment period to a 5-day comment period to expedite funding. For inspections on emergency rental assistance and TBRA, HUD waived the normal housing quality standards with the exception of inspecting for lead-based paint on the exterior of homes. So no having to go into the homes to do those inspections. We, in May, went out to get community input as to what the needs might be, what the communities were needing in terms of the pandemic. That was done through our resource centers and also through online submissions. When that came back, we identified the community needs and took it to council in June. They approved our plan, and then in July, we started our implementation of our CDBG CV, is how we call it, funds. HUD has been very clear that these funds have to be used to prevent the coronavirus, prepare for the coronavirus, or respond to the coronavirus. So any activity that we apply these funds to have to meet one of those 3 tests. So what we presented to council based on all the community input were these particular projects. So we allocated monies for hotel motel vouchers, community food distributions, emergency rental assistance program, utility assistance, and senior hot meals. I'm going to go into detail on each project. So for the hotel motel vouchers, we actually had kind of a 3-pronged approach. One is that we had some existing kind of projects that were being done internally where Salvador Roman was the lead with Interfaith to doing that. And so then we were able to kind of veer those projects to address some current COVID impacts. So that was our Oceanside COVID Bridge Housing Program and our COVID Motel Voucher Program. We then did a RFP for homeless outreach with case management, and we selected Operation Hope Vista to do that here in Oceanside. So they're providing vouchers to families from September through December of this year. Currently, in the month of September, they assisted 15 female-headed households with a total of 24 people in those households. Some of them were single women, some were women with children. The COVID Bridge Expansion Program is case management and supportive services. It was funded in the months of July and August, and it served 24 individuals. The Motel Voucher Program was helping those higher functioning residents that require minimum social service assistance. And that was funded from beginning in September, and it goes through the end of this calendar year. The reason everything kind of stops at the calendar year is because the funds were projected for this fiscal year. It has currently served 13 homeless households. In terms of the food distribution, we again partnered with a couple of different community agencies. One was the Botanical Community Development Initiatives, the Food Shed, and our resource centers to provide weekly food boxes at our resource facilities throughout the community. Their goal was just to assist 400 families. They actually have superseded that goal and assisted 547 families. The resource centers were the only kind of public facilities that were open during the pandemic and continue to be open in operation. And they really served those people of color in those communities. The Emergency Rental and Utility Assistance Program is a short-term rental assistance program. HUD allows for up to 3 months of rental assistance to be provided. And so this is a program that we're doing in-house. We're providing up to $4,500 to pay for rental arrears and up to 3 consecutive months of assistance. We went out and opened up the system to receive applications in the end of August and had it open through, I believe, kind of early October. We received over 56 applications, and we ultimately approved 35 of those applications for rental assistance. The other applications that we did not approve either were over income, or they were not responsive, or they did not meet the COVID test. And so we are projecting on this program of basically providing over 110 in rental assistance to these 35 households and over 6,800 in utility assistance. The utility does assist a couple of homeowners on top of just renters. We also provide senior meals. This is on top of our, or in addition to our regular CDBG senior meal program. These are seniors that maybe would normally be going out to do their food and things, but because of COVID do not want to leave. And so they're newly having this need that was kind of developed because of COVID. So they've already have been assisting 40 seniors, and they'll be providing these home delivered meals through the end of December. The agency that's providing it is working to enroll these people that have been assisted into their other county-funded meal programs so that some type of meal operations continue after our program ends. So as I mentioned, this was all done out of the allocation of $788,000 that we received back in March. We were recently notified by HUD that we are receiving an additional allocation, which is called CDBG CV3. The CV2 went through the states, and we didn't receive that any allocation for that. So we're receiving now over $1.2 million. And so in terms of for coronavirus assistance for this pandemic, the city's basically receiving over $2 million. So there was some questions earlier in regards to what we're projecting to address with those funds. And so staff kind of evaluated what have we been seeing during the last 6 months? Have the needs changed substantially, or have any new needs kind of arisen that we can see and address? So what staff is recommending to City Council, and we're taking this to the City Council at the second meeting in December, is that we're proposing rolling over a lot of these funds because we're still seeing that these same services are needed. So we anticipate continuing emergency rental assistance and utility assistance. We anticipate continuing to do the family food boxes, the hotel motel vouchers, and the senior meals. Some of the new things that we've identified is, for one, when we did the initial allocation, we did not put aside any money out of that allocation for administration. So all of the program administration that's being done for COVID-related is basically the existing staff that have other obligations. So in this go-around, we're allowed to put aside a certain amount of money. So we're requesting the full 20% administrative cap so we can bring in additional hourly extra help to help implement these programs. Additionally, we noticed that a lot of the nonprofits that we work with have been impacted as well, and they don't have these additional resources. So what we're proposing is we put aside some funding so that they can bring in hourly temporary personnel to address COVID-related impacts. So they can do the temperature checks as necessary. They can do those different pieces that would take away from the staff person that is the general program staff person. So we're looking at having that be part of that process. Another thing that we kind of identified, and it goes along with some items that you were talking about, is that with this whole pandemic, there's a lot of evictions and things of that nature. So we're going to be targeting some funds for kind of eviction and tenant landlord assistance as part of this. And then knowing that a lot of youth are having to have been impacted in terms of their ability to do their homework and other things, we're trying to partner with some different agencies or churches or whatnots that are in these communities that are most impacted to create Wi-Fi hotspots. Sorry, I'm not a techie. That would be him. And so those are the items that we're proposing for the new upcoming allocation. After kind of addressing where we've been for the last 6 months, what were the impacts to us to implement these programs? How can we do it better and faster? And so this is what came out of that. I'm now available to answer any questions you may have.
Thank you so much for your report. Do we have any questions at this time from any of the commissioners?
I have a question.
Commissioner Howell.
All right, so under the new coronavirus allocation, I think that the new programs that you're offering on top of what you already have are excellent. I think it's gonna serve the community very well. So you have to live in Oceanside to receive rental assistance, right?
That is correct, although the County of San Diego did receive money itself, and so when the city's programs are not active, people can apply to the county in terms of being a resident within the County of San Diego.
Okay.
But we can only assist one time up to 3 months.
Yeah, and then the amount that you, do you know the number that you're gonna be allocating for rental assistance?
We are programming 300,000 for the rental and utility, but utility is pretty minimal because it's only SDG&E, so 300,000 total.
Because you're probably going to see a spike. I'm sure you're going to open up the applications again, a spike in that, because come January, you know, all that, the 25% stuff's going to be due. And so you're going to see a spike in applications. So that's why I asked if you're going to increase that. So very good. I'm excited.
We hope to have that roll out with, in January after we get council approval in December.
Okay.
Thank you. Do we have any other questions? So I have a question about the senior meals. Do we charge for those meals?
Do we charge?
Well, are the
they
seniors
charge?
being charged for the meals that they
The
receive?
city is being charged, but they do not charge the clientele.
Okay. And who can they contact? Because 40, the amount of seniors that we have here in the city of Oceanside, 40 seems kind of low.
The senior meals is being done through Serving Seniors. They can contact Country Club Senior Center.
Country Club senior.
That is where that operation is done. So the COVID Serving Senior Meal, hot meal boxes, they're doing 2 meals, they're distributing 2 meals a day, Monday through Wednesday, and then on Thursday and Friday, they double up to have the meals for then also Saturday and Sunday.
So did y'all
And they deliver
advertise
them-
these through the senior centers here in Oceanside for our
sorry?
seniors? Did y'all advertise that y'all were giving away free meals to the seniors at the various senior housing
The
here?
senior communities centers know that information, and they speak with the actual agency, and so if they get any referrals, they provide them to the Serving Seniors group.
Okay,
They're in communication.
okay.
Are you, are you able to link with churches? 'Cause I know a lot of seniors that could be homeless, still make it to church, virtual or whatever have you, maybe to link with them as well. Did you say that already? I'm sorry, it's late.
If there's any churches that we should be doing outreach to,
Yeah.
we're more than happy to. It's just, we're going as fast as we can
Okay,
with all
makes
the
sense.
different assistance. We depend on you all to help us get the word out on the programs and services.
Okay.
Okay, thank you. Do we have any other questions or comments for Cecilia? Commissioner Costa?
For which program?
Do you have your mic on? Oh, no, I don't. Thank you.
There are a couple of people I'm thinking of that recently home from the hospital, live alone, limited income, that I might want to recommend for the senior meals. What are the qualifications to be on the program?
Generally, the qualification has to be that either for their own health, they're afraid to go out and they're requesting this, and so then they would be added to that list. Currently, the serving seniors is at their maximum that they proposed for the funding available. They can request to get added to that waiting list potentially for the next go-round of funding, but they have to have some type of either a health concern for themselves to go out in regards to the COVID-19. Again, everything we do with these funds has to be to respond, prepare, or address, whatever.
Okay, thank you. Thank you very much.
Okay, do we have any other questions at this time? Well, thank you so much for your time, and this was a very good report. Thank you so much for the report.
Thank you.
Thank you. So we're going to move down to our next agenda item number 7, and we're going to have the Housing Administrator's Report, Ms. Angie Hannafin. She's going to talk to us about the Cal Home application and notice of funding availability.
Thank you, Chair Williams and members of the commission. I'm providing a report tonight on the Cal Home program. The Cal Home program is a state-funded program that can provide funding for several different things, including first-time homebuyer assistance and rehab funding as well. It is a competitive application, and so the city staff has looked at it and to determine what areas we would be most competitive in and what would be most needed. Staff went to council on October 21st. It was a very short turnaround, so we could not bring this to the commission prior to going to council. We have applied for a $4,520,000 grant from the state for the first-time homebuyer program. The program used to only have a maximum of $56,000 loans. The program has been revised so that the loans are up to $100,000 for the home buyers. We expect to hear back in February whether we do receive the funds. We feel that we have a pretty competitive application, and so we're hopeful that we will get the funds. The city is partnering with a private contractor called Global Union Strategies, who will operate the program for the city. This is something we have not done in the past. However, we are doing that because we lack capacity within the city to operate the program, as well as there's no money out of pocket to the city. Only the contractor is paid by the administrative fees from the state. We anticipate being able to assist 41 first-time homebuyers over a 3-year period. The program is challenging in some ways to administer, because the income cap is 80% of county median income. So these are folks that are low income. So it's challenging to find homes that they can find and qualify for, even with a $100,000 loan. So we're looking forward to that, and we're hoping that we will receive the funding and be able to report back to you that program is successful. The company that we're working with has a very good track record of assisting first-time home buyers, and that's why we decided to go with them. Thank you. That concludes my report, and I'd be happy to answer any questions.
Do we have any questions at this time for Ms. Angie Hannafin regarding Cal Home? Okay, hearing none, if you can go ahead down to report B.
This report is on the notice of funding availability. Unfortunately, we're not quite as far along as we'd hoped. Megan Crooks, our interim director, did provide a report about this several meetings ago, and we are still moving forward with issuing a notice of funding availability, which we will include some project-based Section 8 vouchers, our inclusionary funds, as well as our permanent local funding, that's not the right, permanent local housing allocation. So that is the funds that we are receiving from the state that we have stated that we will use towards shelter operations. So all of those, that and possibly other funds will be bundled up in one application, which we will be issuing out to potential developers or service providers to tell us what can they do with this money that would be to the biggest benefit of our target population, which, just to refresh your memories, our target population is persons experiencing homelessness and extremely low-income individuals. So I was hoping we'd have a little more information for you, and we will continue to update you regarding this process, as it will have a very big impact on what we do. We have not received the funding yet from the state for the permanent local housing allocation. We did receive the notification that and within 60 days, we'll receive the grant agreement. So the state is moving along, but we don't have that funding just yet. And that concludes my presentation on the notice of funding availability.
Okay, thank you. Did anyone have any questions regarding the notice of funding and availability? Thank you, Ms. Hannafin, for your report. We're going to go down to agenda item number 8, which is Chairperson's Report. I would like to report that the Dr. Martin Luther King Community Service Award, it is on the City of Oceanside's website. The deadline is December 7th. And so we're looking for individuals within the City of Oceanside who exemplify the ideas and the works of Dr. Martin Luther King Jr. If you know an individual within our community, then please nominate them for this award. So the nominations are open right now, and it'll be up until December 7th. Also, I would like to report that Shiloh Church here in the City of Oceanside will be doing a Thanksgiving outreach on this coming Saturday, which is November 21st at 11 o'clock a.m. We're going to be giving, I say we because this is the actual church that I go to, we will be giving away Thanksgiving baskets. So they'll get the turkey and all the fixings. We will also be raffling away 3 bicycles. So this will go to the community here. I had someone from the church take flyers over to Laurel Elementary School. Typically, we partner with that school when we're giving away toys and bicycles. Due to COVID-19, we were not able to send the flyers home in the backpacks like we usually are. So we just put it up in the office, and anybody that comes in that sees it will know about it. I'll probably get a report out to Maria. We're located here off of San Diego, Mission and San Diego Street. So we're right here in the community, and so we're hoping that individuals in the community that have a need will come out, because we will be supplying Thanksgiving baskets to individuals. Okay, that concludes my report at this time. Happy Thanksgiving to everyone here. If I don't have an opportunity to see you before Thanksgiving, I wish that you would have a happy Thanksgiving and be well and be safe in COVID-19. At this time, Vice Chair Walshaw.
Okay, I don't have too much, but I have gotten some questions lately from some of the mobile home parks with regard to gatherings, because most of the clubhouses are closed in many of the parks, but not all of them. And a couple of them have tried to have outdoor gatherings recently, which ended up resulting in people getting sick a few days later, which is unfortunate. And I know at one, someone else called to report it to the city, and the police came over and talked to the management and tried to discourage them from, because, I mean, some of these people are used to doing big holiday celebrations with cocktails and barbecues and all of that kind of stuff, and they brought kids and grandkids, and I'm wondering if maybe I'm sure that the city guidelines and the county guidelines are on the city's website. But is there something else that I could circulate to our residents or something that would maybe give them some better idea of what they should or should not be doing, or how we want to proceed into the holidays
Did you
with
want to
this
ask
stuff?
that? Because you could probably call Patrick in special events here for that information, and he could probably get that information to you about what they can and cannot do, who can assemble, how many people can assemble at a time. That's usually who I go to when I have any questions about Patrick.
Okay.
Well,
Angie?
not only that, the County of San Diego, you know, if you sign up for their email
Yeah,
list.
I mean, we've circulated that kind of stuff.
Yeah.
It's just that they're used to what they're used to, you know what I mean? And it's like, they're used to having their holiday party or their Thanksgiving meal with everybody there, and it's kind of hard to get through to them that they need to be a little more diligent right now.
Tell them health is wealth.
I'm sorry?
Angie?
Wealth.
Were you going to say something, Angie?
Chair Williams and members of the commission, what the messaging that we're getting is that there's going to be far more of an enforcement at this point in time. That's the messaging to the city. There is information on the city website. Commissioner Walsh, I'm not exactly sure how you can get the message across.
Well, hopefully we'll just circulate it as an announcement and to the HOAs in each park and hope for the best, I guess, but some people are really hard-headed, and, you know, it's very unusual. I mean, I think our police officers were very frustrated because, you know, one of the events was being hosted by management, and that's, you'd think they wouldn't want the liability, but I just don't think some of them get it, but I don't know. We're doing what we can.
Thank you so much. Commissioner Schott, she's on the phone. Does she have a report at this time? Commissioner Schott, do you have a report at this time?
Commissioner Schott, you need to unmute yourself.
Okay, so Commissioner Keller, do you have a report at this time?
Nothing to report, no.
Thank you so much for being a part of tonight's meeting. Commissioner Costa?
Not at this time, but I have several things in the pipeline, so to speak, so maybe next time.
Okay, thank you. Commissioner Howell?
Nothing really to report, just a comment that I thought this was a great meeting tonight. I'm really happy to hear about all the programs you guys are implementing and already a part of. The rental assistance is definitely, it's needed. It's definitely going to continue to be needed. And that's pretty much it.
Thank you. That concludes our commissioner reports at this time. So we're going to set the agenda for our next meeting, which is December 22nd, tentatively. I say that because that's the week of Christmas, and if we have business, then we will either do it on the 22nd, or we'll look at doing a special meeting because it is the week of Christmas. But tentatively, we will set our next meeting for December 22nd at this time. And at this time, I would like to adjourn tonight's meeting. No further business.